This is CareShift with me, Safik Bilikanti, and today I'm thrilled to welcome John Beadle, co-founder and managing partner at Aegis Ventures, a New York-based venture studio backing health tech companies. John leads Aegis's efforts to tackle healthcare's biggest challenges, from clinician burnout to health equity and financial sustainability, working backwards from health systems to co-build companies around the problems they face every day. Since founding Aegis in 2020, John was the architect of the firm's $100 million partnership with Northwell Health, which has produced a portfolio that includes Ascertain, an AI-enabled case management platform that recently closed a $10 million Series A led by Deerfield Management, Optane, an AI retinal imaging company that launched with $12 million in seed funding to enable early disease detection through a simple eye scan, Claire, a patient engagement and digital service line platform, Hume AI, an emotional intelligent voice, and many more. John also spearheaded the creation of the Aegis Digital Consortium, which now spans 14 regional health systems, including Northwell, UPMC, Stanford Healthcare, Vanderbilt Health, Yale New Haven, Keck Medicine of USC, and Hartford Healthcare, all partnering with Aegis to co-develop, invest in, and deploy the next generation of AI-native health tech. John was such an extraordinary person, and it was truly amazing to learn about venture studios and what he is currently seeing in health tech and what the future holds in healthcare. John, it's amazing to have you on. So thank you for your time today.
Thanks, Vic. Great to be with you. Thanks for having me.
Yeah, so going right into it, when you first saw like the venture studio model, what made you kind of realize this is the correct bet to take instead of regularly just building a venture firm?
So before starting Aegis, I worked for APL Group, which is our sister company. It's a global multi-stage investment firm that historically has invested in much later stage transactions. We were focused at the time I joined 9 or so years ago now around building more early stage capabilities. And so did a lot of early stage investing across industry and geographies, got very excited by what I saw happening within health technology, particularly the advent of AI, finally starting to become deployed much more broadly. And so as we did more and more minority venture capital investments, I started to work more closely with large health systems in the US. And from there, saw a lot of opportunity to extend beyond just making early stage investments to actually manufacturing these companies and concepts ourselves. And so I delved really deeply into the venture studio model, looked really closely and spent time with folks at places like Flagship Pioneering, Atomic, Pioneer Square Lab, Sutter Hill. One of the things I found was that the venture studio model tends to work best when you focus pretty narrowly on a particular industry where you can build a lot of repeatability, where you can form relationships that you can leverage over and over again, and playbooks and partnerships that you can use broadly across a scaled portfolio to be able to drive more efficiencies and economies of scale. And just given all the work and the excitement that we were seeing in health technology, it seemed like a natural opportunity to build Aegis. And as I'm sure we'll get into earlier, we had the benefit of having a kind of large existing body of work with Northwell, which at the time was very focused on advancing their own innovation strategy and driving more AI adoption throughout the system. So it ended up being a very natural thing to do when you combine all those elements.
I wanted to go right into that actually. So you actually started with Northwell, and then now you have like huge base of health systems that you're working with. What was the process of starting with getting Northwell as a primary kind of backing for you guys? And what was the process of giving ultimate trust to them that you guys are going to make great investments for their own patients at the ultimate end?
So initially, it was a very kind of low lift, low requirements partnership where we would simply co-invest in deals together. And I think early on when we started working in partnership, they were looking for capital partners that could bring a complementary set of skills. And this was 3 or 4 years before we formally launched Aegis. And so we were just co-investing alongside them. And I think as we developed more and more capability to actually help the companies and add value to them post investment, they saw that we were a very complementary partner. And as I got to know the leadership and the management team better over time, and we did this all in a pretty deliberate, patient manner, saw a really interesting opportunity to pitch them on Aegis-like model that could solve more broadly, both for the operating concerns they highlighted that would require new sources of technology and innovation, and even equally important for their desire to diversify margin and revenue into, higher margin, better value pools. And we, I think, had a set of skills and relationships and capabilities that could be highly accretive in that regard. And so I'd say slowly, with an emphasis on building trust and trying to, demonstrate over and over again that we were accountable partners. We always delivered on what we promised we were going to do. And ultimately, as time went on and they saw us deliver more and more, I think they were willing to take the leap and partner with us when we launched Aegis. But it was on the back of a couple of years of existing collaboration.
Right. For startups looking to join Aegis, what was the process of how you kind of, I guess, quote unquote, sold them when you guys first started off versus what it is now? I'm assuming these partnerships with Northwell and all other health systems helped a lot in the beginning, but what was the primary way that you told startups that we actually can help you along the ride?
So for us, it was really, we were building all these companies ourselves. And so we would start truly with a blank sheet of paper and spend a tremendous amount of time initially with Northwell's senior management team. They would give us their strategic plan. And we would then be able to form a set of hypotheses around here's the types of businesses that we think could help accelerate an existing set of priorities that you have. And so, for example, if someone said that we're having a lot of challenges with case management, which was actually, what they told us, we then would go and spend a lot of time with the team that led case management, shadow their workflow, understand their problems more deeply, what existing solutions they were using. And then our team of technologists, product experts, entrepreneurs, et cetera, would think about here's what we think a solution could look like that solves your own internal problem. And as we do that, we would bring it more broadly to the market and understand whether we thought that it was a problem that was large enough that it would lend itself to a venture backed solution. And then once we developed enough conviction in the business plan, we partnered with Northwell to build what became Ascertain. So that was an example. And then as we, developed further confidence in that business plan, we brought in, a founding team to advance it with us. And so in those early days, we really view ourselves as co-founders of the company. And I think what folks find very exciting when they come in and want to partner with us to build a solution is we're going to focus them on the right problem. It's going to be a worthy fantasy and something that's worth the next 7+ years of their life as they're building it. We'll capitalize it with them. We'll secure early access to data, to workflow, to a great team of partners who are going to co-develop it with you. And then we'll continue to be partners, all throughout the journey of building the company. And we recognize how difficult it is and what skill sets and capabilities are most valuable to early stage companies getting out of the gate. And I think for us, even before we had the digital consortium, we had a lot of great relationships with other hospital systems. And so in many cases, we had been working with systems for 2-3 years in different ways before they formally signed partnership agreements with us, which is typically how we function anyway. So I think it was really that overall basket of, capabilities that the entrepreneurs we partnered with early on before the model was proven were most thinking about when they made the decision to join us.
Yeah, you mentioned the entrepreneurs that you're mostly backing. Is it mostly like a one person founder? For example, on the case management side of stuff, it's like one founder that you found, and then you kind of help find the CTO and then the management team. Is that how it usually works, or are you looking for that co-founder relationship at the beginning and then start from there?
Good question. It can work in a couple of different ways. So that's one model is we'll initially find an entrepreneur who we think can be a founder and CEO and build around them. Another that we do quite often is we find a team of scientific investigators that have developed some type of, very exciting applied AI research breakthrough. And that will often come from one of our health system partners that has a, university arm that's focused on cutting edge AI research. And from there, we often go through tech transfer to take that team out, capitalize them, and then add additional sets of, experiences and skill sets to that management team. Given that in many cases, those early stage scientific co-founders still want to maintain academic appointments and not entirely lose the link that they have to whatever academic institution that they're spinning out of. So for us, it's quite a flexible model. I think ultimately we are big believers that healthcare is so complicated that if you try to apply a cookie cutter, one size fits all approach, it's a good recipe for failure. And I think we've seen that in a lot of precedent examples. And so as we think about models for innovation, we will start with a blank sheet of paper and an entrepreneur in residence. We'll do these spin outs of investigators. We've started to advance some AI roll ups where we actually acquire companies that we can build new sets of capabilities on top of. And then lastly, a big source of focus has become later stage transactions that leverage more of my background and our heritage at APL. And so carve outs, take privates, more scaled opportunities where we can find either a legacy asset or an internal business unit within a partner that we think can become an industry utility, repositioned to, survive and thrive in an AI era, and then build all the additional resources on top of that existing business today that we think will make it successful in the market. So it's a very broad playbook, and ultimately it's really dependent on what problem we're trying to solve and where we view the biggest opportunity to be.
Yeah, you mentioned this earlier, but like venture studios, when someone thinks of venture studios, you kind of think about like fintech or like developer tools. What made you think, okay, healthcare needs a venture studio? Because I bet when you started this, there's really not that many venture studios in healthcare. And now I see a couple coming in. What was your kind of thesis for this venture studio at the beginning?
Great question. So I've always been a big believer, and this has been a real touchstone since I started Aegis, that venture studios need to be really good at five things. One is you need to be able to identify a set of problems ahead of the market. You need to have the infrastructure to scale those into companies quickly and efficiently and with less capital. You need the ability to recruit amazing talent. And ultimately, that requires a great brand and a great reputation. And you need to offer distribution. So you need to get these things to market much more quickly and then offer that as a benefit to either the entrepreneurs you're bringing in or a team of investigators or whatever you're ultimately building around. And the last is you need to be able to make capital investments that get the companies to enough scale and traction that they can raise money from leading investors in the space that ultimately enables them to be, all be independent standalone companies. And I think when we looked at healthcare, one of the really unique things, and ultimately there's an overlay above all of this, one of the unique things about the industry was most of the very large health systems in the US that are already delivering care at scale are regionally based and non-competitive. And so we could go out with 15 or 14 or 15 groups like we do today and cover 10 or 11% of a very large market. And so that would be enough. That would be enough scale from the get-go that we could get pretty much any company to product market fit if it's something that actually made sense to focus on. And then if we were able to have those partners at the table, it gave us credibility to recruit the best entrepreneurs. We could raise money from limited partners and be able to, deliver a fair return to them. And there's a really good playbook, I think, for the first two, which is how do you go in and partner with folks to identify problems before others? And then what's the playbook for standing those up? And so there were a lot of unique elements about healthcare that I think lent themselves to a venture studio model, and a lot of overlaying elements that I think made it possible for us to build sets of capabilities around being innovation partners to large health systems and then leveraging those innovation partners to drive forward these businesses overall. And so it's ended up being, I think the hypothesis that we had coming in has been validated over time. And we've learned a lot about what, sets of capabilities are most valuable to entrepreneurs and have tried to really double down on those to make sure that we're delivering the most value that we possibly can.
Yeah, you've mentioned how Aegis kind of works backwards with partners. Can you explain what that means? Like how, and you kind of briefly kind of talked about this with the case management example, but for founders listening, how can they kind of quote unquote work with a health system partner in the beginning stages to ultimately get a first check from them overall?
Good question. So we spend a lot of time with our health system partners. And so we will meet with management teams very, very frequently, and they will give us strategic readouts of here are the things that are most vexing for us right now. And what's nice is because we have so much access to this incredible microcosm of academic health systems, systems in urban, rural, suburban environments, large conglomerates, community hospital systems. We can use that broad aperture to try to understand where do we think there's problems that lend themselves to venture backable businesses. And we'll look at 300 or 400 ideas a year in most cases. And we've gotten very, very efficient at putting those through the funnel very quickly, often using AI as a first pass. And then we've gotten our own internal AI capabilities to understand our screening criteria pretty well, which means we can do it very, very efficiently at this point. And from there, we keep a very broad network of talent. And so we have a really robust internal talent function where we've mapped a couple of hundred leaders across the health technology community that we think can make, effective founding team members for the types of companies that we create. And we'll engage them over the course of any given year. We'll host 20 plus events of all sorts of different types. And so we'll have very consistent touch points so they have the opportunity to get to know us. And from there, as we have an idea that's far enough along in our funnel that we're thinking about bringing in a team, what we'll often do is leverage that set of pipelines we have from a talent perspective to bring in a team to help us get to a place where we have enough conviction that we'll actually go launch the company. And then as we do that, that team becomes an integral part of the group of people that are going in front of our health system partner, ultimately saying, we want to work with you over the next 6 or 12 months to co-develop and deploy this, generate a case study. You'll end up benefiting from the technology as it relates to business impact. In many cases, they also become investors in that technology and they're able to benefit on both sides of the coin. So that's really our process for doing it. And we welcome the chance to get to know new entrepreneurs all the time. And, we're always delighted if folks reach out and want to partner with us on things. That's how, we found a lot of people who have ultimately joined Aegis in our portfolio companies. And we always have lots of roles open. So we're always very, very eager to get to know new people that have experiences that could benefit the broader mission we're advancing.
Yeah, like, what does that kind of like go to market look like when kind of recruiting for team members as a venture studio? Do you guys use the brand of Aegis to recruit team members, or is it mostly based on the CEO and their network or your partners' networks? Like, what kind of networks do you guys kind of bring in for that?
Great question. I'd say it's a combination of the two, where, often CEOs come in and have people they've worked with many times over their career who they want to work with again. We welcome that. Ultimately, it's up to the CEO and the founder to decide who they want to have as part of that founding team. We want to be as helpful as possible in accelerating them along that journey, which is why having these warm pipelines across all these key roles is so valuable, as is the fact that they can leverage the Aegis brand, all the credibility and experience and trust that I think we've engendered over the last 5 years since starting. We have a very high closure rate for candidates. And I think a big part of that is that we take a very deliberate, structured approach to getting to know candidates long before we actually need them to join in any capacity. And so that often means that folks have spent 6 months or a year getting to know Aegis, our process, how we build companies, the quality of companies we build, the types of talent we've brought in. So when we actually have a role, it tends to go a lot more quickly since trust has already been established.
Yeah.
And ultimately, as I think about what Aegis does across our entire book of business, what we're trying to do is engender trust at scale. I think it really comes down at the end of the day to trusting relationships among health systems, investors, talent, the entire ecosystem at large. And that's how we've tried to build the entire model.
Yeah, kind of going into like the problem set in healthcare, like what separates like a problem that's getting solved with like a feature or a tool versus one that kind of like justifies a new company to come out through Aegis? Like maybe a better way of saying it is like, what if like that case management was like a feature? Like, how do you know if that was like a could become like an actual company versus just a feature in like a regular company that's that can potentially partner with Aegis?
It's a great question, and it's something that we spend a lot of time debating internally. I think one of the big open questions right now as it relates to building new companies in health tech is where do large incumbents already delivering at scale, where are they going to be able to build capabilities themselves that are going to be competitive in the market as an expansion? And I think this applies in particular to systems of record like the EHR companies, where are they going to build applications that are competitive enough that it's not worth the integration challenges and all the workflow issues of adding a solution on top? Where are the foundation model companies going to be successful? I think that is a big, open, unanswered question. Where do cloud companies have a right to win and offer things either for free or at extremely discounted pricing? If you use it again with very low lift integration and the benefit of trust. And then once you look at that, I think the vast majority of solutions in the market are going to be solved through, those three means: the cloud companies, the large systems of record, and the foundation model companies. And so where are there places where you're going to be able to build something that is so compelling and delivers so much value to your ultimate end customer that you are able to overcome all the systemic disadvantages of being a startup, having no trust, a lack of capital, lots of competitors, et cetera. And so we end up, that's the reason why, to get to 4 or 5 companies that we have high conviction in, you need to look at hundreds and hundreds. Many of them don't, unfortunately, meet that criteria. I could obviously talk a lot about the different theses that we have in places we see opportunities. One that we've really dived deeply into, though, and are quite excited about is this notion of developing new biomarkers for disease and investigator driven innovations. And so we spend a lot of time with the top academic medical centers and universities to try to find AI research breakthroughs, which are domain specific, have a lot of trust. In many cases, they have regulatory requirements, which we actually view as a moat, since that means a lot of the existing incumbents aren't going to compete with us in those areas. And there's an immediate ROI and value proposition that's compelling for our partners. That's not to say we will not go build things that are competitive with all the folks that I've just outlined, but I think the burden of proof for us is higher in doing that, just given all the competition that's out there right now.
Interesting. So that's a very interesting thing that you kind of brought up when it came to the regulatory moat. Is what are the primary moats that you're kind of seeing in healthcare right now when it comes to, obviously we see distribution data as a proprietary data. What are those moats that can potentially have a startup stand out in the coming years as we kind of go more into like a hyper very competitive market?
You captured two of them. I do think distribution can be an enduring moat.
Hmm.
Speed to market in the generation of outcomes and case studies, I really think is becoming a moat in this AI era. Are you able to be that first mover at scale that can own the entire market and then deliver sustainable outcomes and competitive pricing in markets where there's a lot of stickiness, which again is another moat, stickiness and switching costs. How difficult is it to rip and replace something once it's already in? Data is another huge one. I think for us, just the challenges of integration and deployment tend to be so high in healthcare that once you have solutions that are deeply, deeply embedded and you're generating data that makes the product better over time, becomes much harder for new entrants to enter the market. And then regulation is another one. That can go both ways, I will say, because sometimes an existing company in the market will spend a lot of time, energy, and resources developing a new CPT code or getting a breakthrough designation. And ultimately, the second movers at scale benefit from whatever that is after they've spent tens of millions of dollars and many years to create that market.
Yeah.
That's something we weigh really carefully. But I do think once you have a certain number of solutions that have gotten regulatory approval, it becomes harder and harder for others in that market to raise money. And ultimately, all these solutions require money. And the venture capital ecosystem, I think, is a big gating function in what companies are ultimately able to be successful. So from that standpoint, I do think being one of the first couple of devices or technologies to get an FDA approval can be a moat that prevents further competition from entering.
That makes sense. You kind of hinted at like the workflow, like a deep, like kind of heavy workflow integration with providers, making sure the high switching cost, like the switching is not pretty much not going to be present. A lot of health systems that I've spoken to and I've heard about have mentioned how they are working with maybe 6 to 8 vendors and they don't know which one is actually giving a sufficient ROI, and they're having a tough time, like kind of like knowing, is it going if they should continue with this vendor over the other, quit this pilot? How do you kind of advise health systems to kind of pick, which kind of vendors to go with, or which ROIs to capture? I mean, obviously for you guys, there's a high trust variability, but for other health systems that are not partnered with Aegis, like how can they kind of figure out what startups to kind of work with?
My first answer is they should partner with us and our companies because that's something that we try to design for from day one. But look, ultimately, I think any type of software, and this is now true for this emerging category of services as software, where you're using software to deliver what would typically require a tech enabled services approach, you need to build with outcomes as a North Star from day one. And I think that needs to influence the product and the design of everything that you're doing is how do you set up studies and ways of collecting the right data to be able to, to generate attribution. Like attribution, I think is the perennial challenge in healthcare is if certain variables change, how do you make sure that you are able to capture enough of that variation that you can claim that outcome as part of your overall ROI criteria. And something we think about a lot is if you were in a new solution that is attempting to break into healthcare with large healthcare systems, we think you need to demonstrate a minimum 10x ROI. And that can be different, of course, early on where you're trying to generate a case study with a health system partner getting out of the gate, because ultimately you can incentivize those folks differently. You can give them lower pricing. They can have the opportunity to invest. Often they're your highest priority adopters because they're folks that experience that problem deeply enough that they're willing to take the time and effort to co-design it with you. But when we're thinking about broad market adoption, we typically look at that 10x ROI as a North Star. Can we go generate that? And ultimately, you want to have as many publications and examples of that as you're generating case studies as possible. What the Aegis model really tries to solve for, though, is it's very hard getting that first half dozen companies to sign up and go on this journey with you. And so we've tried to build our entire go to market and partnerships apparatus around helping the companies we create get those first half a dozen partners. Because once you have those case studies with the right folks, we end up just putting all of our marketing dollars behind telling the stories of our customers and letting them talk about the impact that the solutions we're building are having on their workflows and their operations.
Yeah, you mentioned a great company that you guys started pretty much Ascertain, like which raised amazing Series A with like I can't remember. And correct me if I'm wrong, but Deerfield. How did
You're
that
covered.
come about? Like, how did that come about? Like, what did what did you see in them or other companies just like Ascertain at the beginning that most startups miss overall? Like, whether that can be from the founders or from the idea specifically. What did they do that could have potentially been different from other startups?
So Ascertain, we built in partnership truly from the ground up with a great founder, CEO, Dr. Mark Machowski, who had started multiple companies before, at the time was an advisor to Aegis actually, and was working at AWS, leading healthcare BD for them, but was a clinician and an entrepreneur and a technologist. This was right around the advent of AI agents as a technology that everyone was excited about. And what Mark was seeing inside Amazon was that the same technology that they were using to make sure that you could get an air fryer shipped to you the next day could be applied broadly to transform administrative burden in healthcare. And so we brought Mark then into Northwell, partnered broadly with Northwell to think about where could we most effectively deploy agentic technologies. Case management was the first use case, and something that we did very intentionally from day one was build this agentic framework to be extremely flexible. So if you wanted to deploy it to case management, for example, we could do that very quickly because we've already developed the models to do that. But if you want to apply it to prior auth generally, if you want to apply it to pharmacy, if you want to apply it to all sorts, to specialty care generally, et cetera, we built the framework to be extensible and very flexible. And ultimately, what I think Deerfield saw was they have a large portfolio of specialty care providers, typically large independent medical groups, all of which were in need of pre-visit automation. And so the way we think of pre-visit is benefits verification, prior authorization, scheduling, everything that happens before someone actually sees a clinician. And they had a bunch of companies in their portfolio that would benefit from Ascertain's technology. And so we've partnered very broadly with the companies throughout throughout Deerfield's existing portfolio, which is driving great value to ascertain commercially. We're generating terrific outcomes in ROI, and Deerfield is able to benefit not just from the growth in value of ascertain, but also in the expansion of EBITDA on efficiency in their portfolio. So we are quite bullish actually on the whole about, can you partner with financial sponsors that own large numbers of healthcare services companies? And then not only are they investing in something that is going to deliver a great exit on a standalone basis, but it can also deliver a huge amount of portfolio impact as well.
That's true. I mean, and kind of hitting on that Northwell partnership, apparently that's been a really good stronghold for you guys. But now you guys work with 10 to 14 other health systems. And one thing that kind of came into my mind was all of these health systems kind of compete with each other when it comes to the best technology, having the best patient engagement, having the best overall kind of critical of care. How do you kind of keep that in check when you're partnering with all of these guys that, you're giving the best quality technology to all of them, and even though all of them kind of I don't want to say don't like each other, but like want them to win over the others.
So it's interesting. When we initially brought in, so Dr. John Noseworthy was the CEO of Mayo Clinic, was a transformative leader for Mayo in enabling it to become the number one hub of health tech innovation, global center for destination medicine, number one ranked hospital in the world every year. He really oversaw that transformation and built something called the Mayo Clinic Care Network in the process, which enabled a very broad set of healthcare systems to leverage Mayo's expertise and care pathways and other things. We brought Dr. Noseworthy in to be chairman of the consortium as we were forming it. And that was well over 3 years ago now. And one of the areas I think he cautioned me on was, everyone, and he would tell you the same thing if you were on the podcast today. He thought everyone was going to be kind of stiff armed and going in front of each other, thinking about the competitiveness and not wanting to work together. And I think everyone realized we did this at a really unique moment in time when everyone realized that there was an existential threat to the entire industry, which was driven not just by payers, but even more importantly, just by overall industry pressure that was reducing margins, making access much more challenging. And so there's a big structural burden that was affecting the whole industry. Tech was one of the only ways that you could solve a lot of these problems. And most of the things we were solving for, they were not finding in the market broadly from a solutions perspective. And it was too big an investment for any one health system to make themselves. And so what we tried to do is bring together a set of non-competitive health systems where we select systems that don't have overlapping catchment areas, are all regional in focus. They may compete for reputations, for example, but they don't compete for the same sets of patients typically. How do we bring them together, partner with them opportunistically, not around every deal? For example, the way we typically end up operating is if we find that 6 health systems in our consortium are experiencing a problem with maternal health, for example, we just launched a company in maternal health. And I don't think any health system would tell you they're not experiencing maternal health challenges, but you need to prioritize. And we need to try to find folks that view this as a problem they're dying to solve today and want to participate as a design partner. We'll bring those 6 systems together. They'll be design and development partners for that particular company. And ultimately, they can amortize some of the costs and time burden of getting that, to a place where it can be scaled commercially and scaled within their own system to be able to solve a particular problem that's deeply felt. And so, interestingly, I don't really think most of the systems, when they actually get down to brass tacks and are working with each other, view themselves as being competitors. I think they've really locked arms in productive ways and have been able to see that this cooperative, collaborative model ultimately ends up better serving themselves, their patients, their communities. And so I think it's been tremendous to see as time has gone on and we bring them together more and more frequently, the relationships that form, the level of trust that's there, and the amount of impact they're able to drive as a result.
Yeah, and a lot of these health systems have, you mentioned Mayo, they have their own kind of corporate venture capital firm where they invest with, Mayo Clinic, and they have their own accelerator. I know Mayo Clinic has their own accelerator, and Mount Sinai, et cetera. What is the exact role that Aegis can kind of come in and say, yes, you guys can keep that, but we can also do this 10x or 100x better?
So the way we try to think about it is Aegis is not a standalone solution for any of these health systems. Like we expect them, something Dr. Noseworthy says that I think is very apt is we will not be your only partner, but we want to be your best. And so we want them to view us as someone that they can come to across a subset of their needs, and then they can fill in the gaps with others. And I think we are big believers that there's enough problems in healthcare that we want as many effective people solving them as possible. And so we are definitely a big tent organization in that regard, since we very much encourage anyone that wants to solve problems to partner with us. We're very open and transparent about everything we're doing, just because there's such an unbelievable surplus of problems and there's not actually as many folks as you would hope solving them. So I think the types of things folks tend to come to us with are one, what are things that they want to turn into venture backed solutions? In many cases, there are things that are built internally by a team at a business unit or a service line where it solves an internal problem for them, but it's not something that they have an ambition to scale nationally or globally. That would not be a place where we would be a great partner. They tend to be quite good at that themselves. And so, do you want it to be a venture backed business? Do you want to leverage our access to talent, to distribution, to scaled capital? Is it something that is quite complicated and where we can bring a complementary perspective? For example, you mentioned a couple of different folks that have done this extraordinarily well. UPMC, Mayo, Northwell, they're all very sophisticated, but I think they also all recognize that they only have their own sandbox to test things in. And
Right.
so most of the solutions that we're talking about require broader access to data, to workflow, to implementation sandboxes for things to truly generalize. And I think we can take things from one deployment to ideally dozens or hundreds as the model scales over time, which ultimately enables them, to scale the amount of impact they're having if it's a solution that's broadly needed in the market. What we typically say is we want to be complementary to everything they have underway and don't view ourselves as competitive to those efforts at all. And in many cases, those systems are willing to tell us, here's everything we're doing ourselves. And there's been many cases where we're willing to help just to be a good partner and a good member of the overall ecosystem and community of practice on things that we don't participate in economically. Like ultimately, we are big believers in delivering impact to our health system partners. And that could mean things that they're working on with us or things they're working with on their own. But ultimately it all, kind of comes full circle in engendering the level of trust that enables us to get things done that are, hugely important on our roadmap.
Yeah, that's exactly well put. And one thing that I've always been curious on the venture studio model has been like the equity structure, but like how an operating CEO feels the quote unquote real ownership. I mean, if coming from a venture studio to me, it sounds like they don't have to work from all the way down. They already have a good foundation to start building upon. What does that equity authority kind of structure look like? And have you had to face CEOs that felt like their ownership is not that valuable compared to potentially Aegis itself or like other partners that they're working with?
Good question. I think you see a lot of models out there, and we are huge believers that the team that's ultimately going to be driving this forward every day needs to be incentivized properly to stick with this for 7 or 10 years or however long it's going to take for these companies to get to a successful exit. And the way we typically look at it is what level of dilution are you likely to experience on your own relative to the amount of stress? And so, for example, if we end up owning, 40 or 45% of a company, whatever it ends up being, how much dilution would you have realized otherwise? And how much stress would there have been along the way? For example, in many cases, going and raising the first, $2 million, let's say, on a YC safe note, that's 20% dilution. You then go raise another 5 or $7 million on, say a 25 cap note, right? That's easily another 20 or 25% dilution. And so when you actually do the math of what most entrepreneurs need to give up relative to what they're getting, we think they actually end up coming out way ahead in our model because they're able to raise money and drive impact a lot more quickly since we're bringing so many capabilities to bear. They also get the benefit of Aegis as a co-founder and the brand and credibility that that confers and the ecosystem that can enable them to drive, impact and achieve their goals a lot more quickly. And so we think in most cases, people actually come out ahead from an equity perspective when they work with us. Of course, there's going to be certain founders that have done this 5 times. Everyone's willing to put money behind them. And, they want to just go do this on their own because they can raise $100 million tomorrow, with a pitch book and an idea. That's
Yeah.
probably not a founder that needs the venture studio model. But we think that's probably less than 1% of all the founders that could be successful in the market. And part of what I think we're trying to do is be an effective partner that can earn the equity that we ultimately have on these cap tables so that folks look at us and say, the partnership with Aegis is one that we would do every day of the week if we could do it over again because they've delivered so much value. So for us, founder NPS ends up being one of our most important North Star metrics that we measure ourselves against.
Very interesting. So going into healthcare specifically now, we all see that healthcare AI is kind of having its moment. Like it's becoming very big. Even like generalist funds are like specifically focusing a lot on healthcare. How are you reading like the bifurcation between digital health and healthcare AI overall? And is there any similarities of like how they look between them?
It's interesting. It seems to me almost like a distinction without a difference because at the end of the day, for any solution today to be transformative and effective in health technology, you need to be AI native at your core. I mean, even existing large scale incumbents are all trying harder than anything else to transform themselves to be AI native. And so I think using AI is almost table stakes at this point. What it
Mhm.
ultimately really comes down to is what outcomes are you driving at what cost, right? Like that's really the ROI formula that everybody is looking for. And I think anyone that defines themselves as, oh, I'm not leveraging AI effectively because I'm an old school health tech company is quickly going to be displaced by folks that are using more AI while also keeping in mind, how do I make sure that I reduce bias, that I reduce risks and all the things that are required to be an effective, steward of patients and communities and the partners that we all serve. But ultimately, I think everyone needs to be AI at their core to be successful, just given the massive shift that we've seen and how effective the technology can be.
For startups that did start maybe 2, 3 years ago when they were probably not AI at its core, what are you seeing those companies doing to kind of rapidly change to use AI as their main kind of forefront? Obviously not as a selling point, but like as the forefront of adopting the technology versus startups that are building now and have the opportunity to use it immediately. What is the kind of process like for them?
Question. Luckily, startups that were launched 2 or 3 years ago, I do think most of those folks, just given that they launched in the post chat GPT era, tend to be pretty well positioned. And when you look at a lot of the high flyers of the world, the Abridges, the open evidences, et cetera, in many cases, those were companies that started earlier,
Mhm.
redefined how they operated in light of AI. And often AI enabled their products to work in a way that, they didn't necessarily before. But I think ultimately what all the successful ones are doing is they're training their teams to be AI native. They are measuring outcomes from AI and thinking very thoughtfully about how to infuse it throughout the entire company and throughout all their processes. And they're recruiting new leaders in that are more AI native and are able to drive more transformation. But I think an overlay to all of that is they're all trying to use it responsibly. And they're recognizing places where you need a human in the loop, you need clinical oversight, you need people monitoring drift and bias and all these things that can plague, large scale deployments of AI. And so I think it's a real balance between how do you move quickly and leverage all the benefits associated with AI while also making sure that you don't move so fast that you're being irresponsible and opening up, opportunities for things to go wrong in ways that are difficult to recover from.
Yeah, because as you mentioned, I mean, healthcare is such a huge trust kind of navigation for like if you do one thing that's wrong, whether that be on claims or in billing or for patients, as the worst case scenario, that can kind of lead to even worse like things like where in the point like there's no point of even you building a startup or like
For sure.
you know what I mean? Like it's more harder to kind of find or trust even if you're already broke, especially in healthcare. So
Totally agree.
yeah. Where in healthcare do you think Gen AI is actually overhyped right now?
So I think everyone is talking about the administrative side of things.
Yeah.
And we are seeing large impact there for sure. But I mean, I've seen some estimates that say of the trillion two or whatever number it is, at administrative cost, we're going to cut 70% of that. I just don't see that happening anytime soon. There's just so much legacy infrastructure and technology and barriers to scale deployment in healthcare that I think the impact we see broadly in spending is going to be slower than most people expect. I actually think it's underhyped though, as it relates to the direct application in clinical care. Like one thing I think we've seen that's been a step change level of improvement is the number of doctors that are using AI every single day, seeing tremendous value from it, and eager to use more AI in their day to day workflows. And we've already seen many cases where AI is making better diagnoses than a doctor would make on their own. It's eliminating their pajama time, and a lot of time they spend needlessly on notes and charting and things like that. It's amazing and imaging and being able to, serve as a co-pilot and makes folks work more effectively. And it's also able to extend the reach of the healthcare system into patients' day to day lives through things like patient reported outcomes and wearables. And then it can also make sense of that data and make it clinically actionable. And so I think you're going to see a lot of really exciting deployments in the direct application of clinical care, because the barrier that I saw, 3 or 4 years ago that doesn't exist nearly as much today was just clinical skepticism of how the technology can work. I think everyone has seen that this generation of tech is far better in almost every way than the generation we had in the decade before.
Yeah, you mentioned kind of more physician adoption. I think the AMA kind of said 2 in 3 physicians were using AI by the end of like 2024, 2025. That's like a huge step function from what it was a while back. Clearly now, I don't think clinical adoption is the bottleneck anymore. What are the constraints that you kind of currently see, for startups or in health systems overall? And mostly, I'm assuming it's in procurement, IT, and all of that, and the final sign off. But like, where are you seeing as the final kind of bottleneck?
Mean, you've highlighted one of the big ones. I think what we are seeing broadly right now is huge backlogs in IT in particular. And that is not to say anyone is to blame for that. A big problem I think you come across a lot when you're dealing with large health systems is they all have huge, massive IT projects underway. And that can mean we're moving to a single instance of Epic. We're consolidating all of our Salesforce instances. We are doing a massive implementation of a huge new cloud platform. We have, 26 deployments underway of new solutions. And so you kind of end up needing to one, either get in the queue or demonstrate that you are so high value that you can jump the queue and accelerate how quickly you can get deployed. And, there are many cases where even if you have something that is super high priority, you have the right sponsorship and folks willing to go to bat for you, there's just not enough IT capability within the health system to move you up in line and get you deployed more quickly. We've tried to solve that in part, particularly for earlier companies, through the partnerships that we have. In our experience, solutions that come from trusted counterparties are often accelerated over those that are coming from people that they have no relationship with. But at the end of the day, I think a question entrepreneurs should ask themselves before they go launch a company is, if you're a health system, you're taking hundreds of calls every day, new solutions in many cases, across all your business units and service lines. Less than 1%, significantly less, are actually going to end up getting deployed. And most of them, in my experience, are good pitches. You'd listen to them, you'd say, "Oh, I could see how that delivers value, but does it rise to the level of I am going to drop everything that I'm doing and go to bat with our CFO, with our CIO, and all these different stakeholders that you need to line up to actually get something deployed?" And in almost all cases, it doesn't. It can still be a great pitch, but not rise to that level, which just speaks to how challenging it is to scale and get a health tech solution broadly adopted.
Yeah, it sounds like it's mostly a trust thing. If you can have champions that can help you kind of get there, it sounds like it's a much easier place than just like cold cold calling a health system or someone an exec or someone that's in there to kind of sell your product. I mean, it sounds like it's just much more easier to kind of find somebody that can trust or use the product over time and then make those intros for you to kind of find it over time. But on the other side of it, I'm very curious is the payers. And payers have been worse than, I guess, health systems when it comes to super long sales cycles. very abundant procurement, very bad. And do you think AI is going to make it better for payers to kind of enable more solutions, or do you think it's still going to be very beneficial for providers and health systems?
I think the payer channel is going to be hard for startups. And I think that's true for a couple of reasons. One is payers often have the financial capability and they're operating at enough scale that they can build things internally. And a lot of the large payers are doing that. Two, they're often looking to partner with much more established companies. And so they're partnering with the cloud companies. They're partnering with existing, software solutions that are in the market operating at scale, already generating outcomes. And, they are often not looking to partner with very early stage companies. And so I've seen, few cases of, very early stage companies going to a huge payer and getting them to want to grow with you. It just doesn't happen in the same way. And
Yeah.
so for that reason, I am not particularly bullish on the payer channel generally. I
Mm.
do think there's going to be, rifle shot opportunities where you can deliver a lot of value for a payer and where they're going to want to work with you for that reason. But in one that I think we see is if there's a solution that is at the nexus, for example, of payer and provider or payer and life sciences, and it's something that would be hard for that payer to build themselves and a solution doesn't exist in the market that naturally solves it, that's the kind of rifle shot that I think could mean that you do get scaled adoption quickly with a payer, but we haven't yet seen a lot of those opportunities enough to go all in on the payer channel in the way that we have providers.
Yeah, and I mean, I know payers get pitched so many also AI products from entrepreneurs all the time. And as you mentioned, it's very difficult for them to find the scalability to kind of even I mean, it's a classic, buy it or build it in-house. Do you think at one point, whether that be the vendor or the payer kind of adopt like using vertical tools is going to be the best solution, even for more specifically for providers, or do you think it's going to go into like a more of a horizontal, foundation model providers, as we kind of mentioned with OpenAI and Anthropic launching their healthcare solutions? Do you think there's still room, a lot of for more vertical point solutions out there, or is it mostly horizontal? Or as it grows, it's going to be more horizontal?
So I think it's going to be challenging for the foundation model companies directly to serve healthcare in that way. I mean, they can try using, forward deployed engineers and big implementations, et cetera. But I think it's going to often be very expensive for healthcare systems to go do that. And they're going to need to continually be able to refresh those solutions, et cetera. And I also think they're just going to find that it's easier to go to customers in other industries that move more quickly, have fewer IT and security and compliance problems, bigger markets and bigger companies they can serve. And so as I think about the long tail of companies, I think most companies in healthcare are going to be too small and too difficult for the foundation model companies to want to prioritize. And I think what they'll ultimately conclude in the same way, for example, you've seen Harvey and Lagora in the legal industry. They're really just token resellers for Anthropic and OpenAI and others. And so I think the approach that all the foundation model companies are going to take with some number of exceptions, is we want to be best in class at healthcare. And ultimately, there's a lot of customization and bespoke work that needs to sit on top of the foundation models. And the more and more deployment there is of solutions that leverage an FM, and that can be interchangeable, which FM wins, depending on which one is best in healthcare, they benefit because those companies are going to need to sell tokens to them anyway. And so if I were running healthcare at one of those places, what I would focus most on is how do I get all the leading companies to become very reliant on my model as they scale?
Yeah, absolutely. I was thinking the exact same thing. But, another kind of challenge for healthcare startups is those EHR incumbents like Epic. Well, how do you kind of think about building portfolio companies that have to coexist with them? Like how does that look over time when with the scary breathness of like Epic kind of coming into your kind of topic or sector overall?
We have a very good relationship with Epic. All of our health system partners are Epic clients.
Yeah.
And so we spend a lot of time looking at Epic's roadmap, where our providers are seeing sufficient value from what Epic is doing and what's on that roadmap, and where there's solutions that complement what they're doing. And so we don't want to compete with them. We want to do things that help health systems get the full value out of all the other large scale IT investments they've made, Epic being a foundational one. And so we're always looking to complement, not compete, and think there's enough opportunity and enough problems in the market that we can build, lots of companies without ever really directly, running head on into their roadmap. So that's how we typically approach it.
Yeah. So what are the two more questions, I promise, till a quick rapid fire. What are the next kind of wedges that Aegis is looking at right now in healthcare, more specifically in healthcare AI?
So two big ones are I mentioned earlier the biomarker
Yeah.
discovery. I
Yep.
think there's huge amounts of opportunity in investigator driven innovation where we're finding teams of amazing AI researchers that are forming breakthroughs that are defensible, backed by leading science and publications and world class people, and where we can build things that can scale a lot more quickly than the last generation of health tech companies. And then the last one is I think there's a lot of companies that are already operating at scale that are currently publicly traded that could be taken private and repositioned to survive in this era of AI. And in a similar vein, there's a lot of business units within our health system partners that could be massively transformed using AI and scale to the industry. And then in both cases, you start with a foundational asset that already has distribution, scale, teams, trust, et cetera, and you can accelerate it from that foundation. So those are two places that we're spending a lot of time right now.
Final question. You mentioned kind of the public companies in digital health specifically. I believe the last one was Hinge Health that went public. What do you think is the future of kind of healthcare startups, healthcare companies going public or staying private? Do you think it's going to be like a Stripe-like scenario here, as we're seeing with Open Evidence and a Bridge, or at one point do you think the public markets are going to open up much more for them?
Great question. I do think generally you can survive and thrive as a private company a lot longer than you ever could in the past. And
Yeah.
so I do think that's probably going to be a trend. But a trend that I'm even more focused on is I think you're going to have companies, Commure is a good example, and I think has done this well, that are aggregating lots of different solutions and trying to become end to end providers and also scale in a way that enables them to generate EBITDA and profit and metrics that public market investors are going to value. And I think in those cases, you're able to not only, survive and thrive as a publicly traded company, but also as a sponsor, a potential sponsor acquisition. And there's just huge amounts of dry powder on the sidelines right now from private equity firms that are looking to make bets both in healthcare IT and healthcare services. And I think this technology is enabling companies to operate a lot more profitably with higher growth and better margins, which both sponsors and public markets should reward. So I think you have a lot of options now as a healthcare founder if you're, building companies in the right space with the
Yeah.
right numbers and the right focus areas, which is great for the industry.
Yeah, for sure. Now, quick rapid fire here, John. Are you ready?
Absolutely.
So, what is a bet you're making right now that you can't fully defend with data just yet? And you probably kind of tapped into it, but is there any kind of markets that you're looking at that you can't really defend? It's a nice kind of moat going into the future.
Good question. I would say genomically driven drug discovery. And you'll hear more about that over the coming 6 months or so.
Interesting. What did you believe about healthcare 5 years ago that you completely changed your mind on?
The importance of trust in driving scale above everything.
True. Trust is the almighty, I feel like, especially in healthcare. Final question. What was the best advice you were given that you did not listen to, but in hindsight, you should have?
A lot of people told me, don't launch Aegis. It's going to be too difficult. It was extremely difficult, but I'm very glad that I did it.
Yeah, that's a good one. Thank you, John. I appreciate this, man. This was great.
Pleasure. Thanks for the talk. I really enjoyed the discussion.